You know those things that sound good in theory, but then once you spend just the smallest amount of time looking into it, you realize it's actually a nightmare? That sums up work requirements. My name is Brittany Page, and this is the Page Perspective. My goal with this video is for you to be armed with all of the information you need to change hearts and minds, or alternatively, just absolutely destroy Uncle Gary come Thanksgiving when he starts up about how we need to require people to work if they want access to things like Medicaid. However you choose to use the information is up to you, okay? I'm just here to deliver it. Now, we could jump back to the Trump administration in 2018 when he pushed for work requirements to be added to government programs like Medicaid. Remember that? One of Trump's few policy priorities. At the time, Arkansas was the first state to put work requirements for Medicaid into place. And it was a spectacular failure in every way. And rather than learning from these mistakes, Republicans have doubled down. But rather than going all the way back and taking a trip down memory lane, we're going to focus on the present. We're going to spend some time today on Georgia's recent effort to implement work requirements. But it's important to understand that other states are trying to do the same thing, and Republicans continue to believe that this is the way forward. So let's focus on Georgia. They are wasting millions of dollars, with the vast majority going toward paying consultants and actually getting their program up and running while failing to reach their own stated goals for the program. Now, most states have adopted Medicaid expansion, and they have done so without adding work requirements. But just so we're on the same page here, Medicaid expansion is crucial for ensuring health insurance coverage for those with low income. Reading briefly from the Kaiser Family Foundation. Quote, the Affordable Care Act's Medicaid expansion expanded Medicaid coverage to nearly all adults with incomes of up to 138% of the federal poverty level. That's $20,783 for an individual in 2024, and provided states with an enhanced federal matching rate for their expansion populations. The benefits for individuals and states upon expanding Medicaid are just so overwhelming that it makes zero sense for these Republican-led states to hold out on expanding Medicaid or to add work requirements. If we look at the Center for Budget and Policy Priorities, we see Medicaid expansion improves access to care, including preventative care, mental health care, and things like medication-assisted treatment for opioid use disorder. Medicaid expansion improves health outcomes, improves financial security, including reductions in evictions for low-income people, improves economic mobility, and reduces uncompensated care. And as always, I link to all of these sources in the description so you can look at these benefits further, because they don't stop here. Reading again from the Center for Budget and Policy Priorities, quote, expansion has produced net savings for many states. That's because the federal government pays the vast majority of the cost of expansion coverage, while expansion generates offsetting savings and, in many states, raises more revenue from the taxes that some states impose on health plans and providers. Under the Affordable Care Act, the federal government paid 100% of the cost of expansion coverage from 2014 to 2016. The federal share then dropped gradually and settled at 90% for 2020 and each year thereafter, leaving the states to cover the small remaining share. But Georgia said, no, we don't like savings. We don't like improved health access and health outcomes for our citizens. We don't want any of this. Instead, we want to make life harder and more dangerous for those most vulnerable in our society. We want work requirements. So they implemented pathways to coverage. Pathways, meaning hoops. There are hoops you have to jump through in order to get something necessary for survival, healthcare. Reading from the Atlanta Journal-Constitution, quote, Georgia Governor Brian Kemp's plan for a conservative alternative to Obamacare's Medicaid expansion has cost taxpayers at least $26 million so far, with more than 90% going toward administrative and consulting costs rather than medical care for low-income people. Kemp's Georgia Pathways to Coverage offers government health insurance to people earning up to the federal poverty level, $15,060 for a single adult, if they can document that they're working, in school, or performing other qualifying activities. Since July, when the program began, about 3,500 people have signed up, according to state officials. That's a small fraction of the Georgians who could enroll if the state expanded Medicaid without such requirements. Now, if you're wondering about whether that number is small or large, let's put it into context. Quote, "The low enrollment for Pathways has disappointed supporters as the state projected more than 25,000 residents would enroll during its first year, and 52,000 by the end of 5 years, according to its application to the federal government." So they expected 25,000 residents to enroll, and only 3,500 have. That means people who truly need healthcare are not going to receive it simply because of these hoops. And this is the thing that always happens with work requirements. Money is wasted on red tape, implementation, and administration. Thousands of people lose coverage, money is wasted, and this is probably the most important point for people who claim to support this nonsense, work requirements don't even increase employment. Remember when I talked about Arkansas leading the charge on work requirements tied to Medicaid after the Trump administration made it their big goal in 2018? Let's look at the Center for Budget and Policy Priorities on how that impacted employment. Quote, "The Arkansas requirement did not result in any significant changes to employment or number of hours worked between 2018 and late 2019, after which the work requirement was put on hold. Focus groups with participants found that most were already working or looking for work and were highly motivated to work as much as they could because of the financial pressures they were already experiencing." Highly motivated to work because of financial pressures they were already experiencing. This is the thing that people seem unable to grasp. And they said focus groups found most were already working. This is also illustrated by data. Turning to KFF, quote, "KFF analysis of federal survey data from 2021 reveal that, overall, more than 6 in 10, 61%, non-elderly adults with Medicaid who are not also covered by Medicare and do not qualify for Medicaid as disabled under the Supplemental Security Income, SSI program, referred to after this as Medicaid adults, were working full or part-time. The leading reasons for not working among remaining Medicaid adults were caregiving responsibilities, illness, or disability, or school attendance. The remaining 9% of Medicaid adults reported that they are retired, unable to work, or were not working for another reason. Not only that, but they also looked at the strongest predictors for work. Those are health and education. Quote, "Health status is the strongest predictor of work, with people in excellent or very good health 27 percentage points more likely to be working than those in fair or poor health. Education level is also a strong predictor of work." And if all of this feels too distant and impersonal, let's turn to Adrian McGonigal, a man who lost his Medicaid coverage and subsequently his job when Arkansas implemented these cruel work requirements.
Adrian McGonigal's life is coming undone.
Never wanted me to stay longer, but
in the past few weeks, he's lost his job, his health insurance, even his feelings of self-worth.
without my medication, I can't really sleep good, so.
He's worked all his life, but now, at the age of 40, he's entirely dependent on people like his mom to get by. And he blames the U.S. Department of Health and Human Services.
Your status as far as
The Arkansas Works is concerned.
This summer, he had a decent-paying job at a chicken plant outside Bentonville. But when the Trump administration allowed the state of Arkansas to impose new work requirements on Medicaid, he, like many Medicaid recipients, got confused about how to report his hours.
I thought that everything was good about this. I thought it was just a one-time deal that you reported and then that was it.
He was wrong. He was supposed to log those hours online every month. He became one of the 12,000 people that the state has booted from the Medicaid rolls in the last 3 months.
How do I get my insurance back on?
He discovered this only when he went to fill prescriptions at this drugstore, and the pharmacist told him, "Sorry, your coverage has been canceled."
And that it was going to be like $340 for one of the medications and like $80 for the other one.
So he left empty-handed. This was a big deal because McGonigal has severe COPD, a chronic lung disease that makes it difficult to breathe. Without his meds, he landed in the hospital multiple times and missed a lot of work. His supervisor tried to accommodate him, but he wasn't healthy enough to perform his job, so he lost it.
He was working, like most adults on Medicaid. This all comes back to the same tired tropes about people who are struggling financially, people who are poor, that they're lazy and they don't want to work. We blame them rather than the system, because it's easier to say, well, they must have done something. They must have made a decision to put themselves in that terrible situation. That way we can convince ourselves that we won't ever be in that situation because we will make different decisions, right? We're different than those people, right? Wrong. If you aren't in Adrienne McGonigal's position, you're lucky. There are countless people in Adrienne McGonigal's position right now in Georgia, but we won't know the full extent or impact until reporters are able to get on the ground and shed light on what is going on, like Catherine Rampell did in that news package from PBS. This is why politics matters, and your involvement in politics matters. Everything is political, and we've got to keep saying it loud and proud. Work requirements do not work. You hear that, Uncle Gary? What do you think? I'd love to know. You can call 657-464-7609, or you can send an email to idoubtit@dollemore.com. You can support my work at Patreon at patreon.com/idoubtitpodcast, or by becoming a channel member right here on YouTube for as little as $1.99 a month. In fact, let's thank our new channel members right now, and that is Michael C., Daphne W., Marvin H., NC, Michael S., Kristen D., Stan M., and David H. Be sure to email me your mailing address so I can get you some stickers if you haven't already. And thank you so much for your support of the show. I'm looking forward to reading your comments. Take care, and I will see you next time.